Daytime Doctor TV is about to change. The days of traditional dental thinking are over. We're here for dental consumers who are tired of crowns, tired of repeated invasive procedures and dealing with problems in their mouth that seem to never go away. There is a better way. There is an alternative approach leading to whole mouth and whole body health for the rest of your life. Stay tuned to learn more now. This is the Dr. Shoup Show. Here's your host, Dr. Randy Shoup.
Hello, everybody, and welcome to the Dr. Shoup Show. I am your host, Dr. Randy Shoup, and when I'm not in my office at Microscope Dentistry by Shoup, right here in central Indiana, I have the honor of traveling the globe, teaching other dentists the ultra-conservative dental techniques that I use in my office. You know, dental schools have been teaching the same systems for almost 150 years, and there certainly is a new way. There certainly is a better way for you to receive the dental and health treatments that you want that will make a big difference and a huge impact in your life. I also teach what's known as the oral and systemic health connection. That is, we know that the health of your teeth and the health of your gums has a direct impact on your overall body health. Did you know that the health of your teeth and gums has a major factor in your risk of a heart attack, in your risk of having a stroke, or your risk of coming down with diabetes? You know, on this program, we're going to bring to you experts on a dazzling array of really fascinating topics, and they're going to bring to you information that you're simply never going to be able to find anywhere else. Topics like osteoporosis or sleep apnea. Or we'll talk about, did you know that nutrition truly is the key to your overall health? And how about when the dentist tells you you need to or you have to have a crown on that tooth, that it's probably not accurate? How would you like to never have to have your tooth ground down and have a crown on it ever again? We're going to talk about these topics and so many more. But for today, let's get started and let me introduce to you our guest. We have Margie Setterloff with us today. She started her career as a physical therapist. She transitioned into a certified nutritionist and then a certified health counselor. And she's going to bring that vast array of knowledge, information, and experience, and she's going to share with us everything we need to know: fact, truth, myth, misconception, all of the realities of the benefits of CBD oil. And we're going to do that right after this message. Well, welcome back, everyone, and I'm absolutely delighted that you are here because you get to meet a really good friend of mine, Margie Setterloff. Margie, how are you?
I'm doing great, Dr. Shoup. How are you doing?
I'm doing well, thank you very much. Now, she's very formal today. We know each other because Margie has been an integral part of our office in fulfilling those needs that we have for our patients that want health or nutrition or wellness counseling or benefits, and she has really been instrumental in giving us that aspect to help our patients. So I told everybody, Margie, about your physical therapy beginnings and then nutrition and then health coaching. Could you tell us all about your journey? How did you come through to where you are today?
Well, after spending so many years as a physical therapist and really seeing the rehab side of disease and illness and injury, I just knew that if we could focus earlier on in life about making some lifestyle changes, changing the way we eat, we could really avoid or even reverse many of the common diseases that we commonly see that accompany aging. So that's why I went back to school and got some degrees in nutrition and just always believed in using food as medicine, bottom line, for prevention and then focusing really on overall wellness so that people can begin to own their own health, basically, and make better choices down the road once they take responsibility for their own health.
Well, you have a phrase that you use with our patients, and it has stuck in my head, and I really like it. It's called, you say, aging is a process, but getting old is a choice. Explain that to the folks that are watching.
Well, I think that the bottom line with that is that it's inevitable that we are all going to age. We can't fight that, but we can make a choice in how that is expressed as we get older. We can either embrace it and do the things in our life that are going to enhance our aging, or we can make choices that are going to even mentally take us down a road that we don't necessarily want to go down. So it's a conscious choice we make each day, and what we do, and the decisions that we make for our own health.
Perfect. The things that I've learned from you, one of the things that I think is crucial is that you base a lot of what you do, you base a lot of your therapies and a lot of your ability to get people to become healthier strictly based on their nutrition, strictly based on a holistic approach for the fuel that we put into this machine that we call a body has to be appropriate fuel, has to be the right fuel. If we keep filling our engine with really, really bad go juice, then we'll get bad results and bad performance. Talk a little bit about how critical you feel nutrition is, and not exotic nutrition, but day in and day out, bread and butter, healthy nutrition is for maintaining your vigor in life, maintaining your ability to function the way you want to, and maintaining your mental acuity.
Well, that's a really good point. Anything that we take into our body, our cells are going to use that to create new cells. So we just need to make sure we're giving our body the right raw materials to rebuild and reinforce the good nutrition and the good health that we want to have. So, and again, everything doesn't have to be organic, but I think the cleaner that we eat and the more choices we make that cover the rainbow of foods to get all your antioxidants, and just knowing where to start with that is hard for people. They just don't know even where to begin many times.
Right.
So keeping it simple, I like to keep it simple for people.
Well, that brings us to a really important point, and really the topic that we're going to talk about today, in that, when you eat well and you eat correctly, you can really make your life a lot better. But there are things that go south. There are things that go wrong. There are body functions that don't start to work as well. And I think that's what really led you into this entire world of CBD oil. If you would please tell everybody how you began your journey and where you are with your involvement in the CBD oil movement.
Well, I started learning about CBD oil about 2 years ago. Got curious about it, but that was before all the hype and a lot of the what I'd have to say confusing information's been out there. So I started studying it, and I started using it. I started sharing it with some other people, and I started to see a lot of benefits firsthand, and I knew that there was something to this. So what I discovered was that we really have a natural solution that supports the body in getting healthy and staying healthy. We have something that we can offer people as a safe alternative to so many of the over-the-counter medications that people are using and basically overusing today. And then lastly, we've got something that will allow people to take more responsibility for their personal health and wellness. And as I mentioned earlier, when people take ownership for their health, they just make better decisions all the way around. So I've just been a real fan of the CBD oil because it has helped so many people in ways that other things just haven't.
Well, I'm sure that there are a lot of folks that are listening to this have heard all of the controversy, heard all of the legislation that was passed and so forth about legalizing or making CBD oil okay. Help break down for me, please, the CBD oil as opposed to hemp, as opposed to marijuana, as opposed to THC. All these things get thrown into a singular basket, but pluck them out of the basket and help us understand the differences between those things, please.
Sure. Well, starting with the definition of what CBD stands for, it stands for the term cannabidiol. And it's actually one of over 100 different active compounds in the cannabis plant. It is, however, the most active compound that has significant therapeutic value for numerous medical conditions. But without the mind-altering high, of the THC, which is another cannabinoid that does have the psychoactive compound or psychoactive properties. I mean, and like you said, the confusion, people use the word cannabis, they use hemp, they use marijuana, and interchangeably in a lot of things. But the truth of the matter is cannabis is the original plant, and it has two species. It can be harvested to produce either industrial hemp, or it can be harvested to produce marijuana. Both hemp and marijuana contain the CBD. CBD is the one that heals you without the high, and the THC is the one that has a psychoactive compound or psychoactive component. But what makes the difference between hemp and marijuana is the amount of THC that's in the plant. So in order to be considered industrial hemp, the THC component has to be equal to or less than 0.3%. And that is the difference basically between hemp and marijuana. So we're talking about hemp, industrial hemp today, not the medical marijuana, which is also very controversial today.
Sure. It's like, and people around here are very familiar with various strains of corn or various strains of hybrid soybeans, in that, you know, the geneticists make different varieties. If you will have a backyard garden, you'll have one variety of rose over here and a different variety of rose over there. So the plants have this, there's a hemp variety and then there's a marijuana variety. And if you harvest the marijuana variety, you have much higher levels, concentrations of THC. That's the characteristic of the plant. But if you harvest the hemp plant, grow it, it has very low levels of the THC, of the psychotropic active drug, but it has lots of this CBD oil in it, as well as the other components. So historically, where do we find that that most of the hemp or that we're using today is produced?
Well, in the United States is producing actually the safest and the best hemp. If you're looking for a good source of it, you want to make sure that it is harvested here in the United States.
Well, we have about a minute and a half left before we have to go to commercial break, but I do want to talk about a little bit of the history of it. I mean, people think that we've just invented this back in the 60s when everybody was smoking grass and going to sit-ins. But the fact of the matter is we have historic data going back a long way. How far back can we find humans harvesting, using, or taking the value out of these hemp or marijuana products?
Well, we can take that back. There's documented proof of the production and the use of cannabis back 4000 BC. Chinese were using it for clothing, for healing, for all kinds of different industrial uses, and for ropes. Even our Native Americans planted it. Our farmers were required to grow it. And then back in the 1900s, it was actually the third most prescribed medicinal agent for 60 years running, until 1937, when the Marijuana Tax Act came, and it just basically made everything illegal. It threw the hemp out with the marijuana and basically demonized the cannabis. And that's been that way for 80 years until this year.
Well, most people don't really have an appreciation or an understanding, but our homegrown Eli Lilly pharmaceutical company used to be one of the nation's leading producers of hemp and of marijuana products until the 1936 Tax Act came along. So when we come back, Margie is going to go into detail and tell you how CBD oil actually interacts with the human body, what sort of effects there are, and she'll tell you of a discovery of a system within the human body that science really wasn't aware of until we discovered these cannabinoid products. And she'll do all of that right after this message. Well, welcome back, everybody. And as you know, we have Margie Setterloff with us. She is a physical therapist and a certified nutritionist and a certified health coach, but she also is an expert on the use of and all of the things surrounding CBD oil. And as I told you right before the break, we're coming back now where we're going to talk about how CBD oil actually works in the human body. And I told you that there was an entire human body system that we simply didn't know existed until we started doing the research on these endocannabinoids. So Margie, with that information, I know my guests are going to want to see how you can tell us how this stuff all interacts with their body.
Well, the first thing we have to think about is that why hemp CBD oil is unique. It's really more than a nutritional supplement. It's really what we call an adaptogen, and it adapts to what your body needs. So it's like a superfood that actually affects our whole entire physiology, not targeting just one aspect of our health, but it helps support our body's optimal functioning. So with that, you mentioned the system of the body that I want to bring up, and that's called our endocannabinoid system. Mm-hmm. Because we really can't talk about hemp if we don't talk about what this system of the body is. Sure. It is actually the largest biological system of its kind throughout our entire physiology. It's a very exciting medical breakthrough because it was only discovered back in 1991, and it was named after the cannabis plant that inspired its discovery. So it is a complex system of signaling molecules and their receptor sites that are located all throughout your body, but concentrated mainly in your brain, your spinal cord, and in your immune system. The main function of your endocannabinoid system is to constantly monitor all your other body systems, like your cardiovascular system, your digestive system, your musculoskeletal system, all of these different systems in order to maintain health and balance and bring your body into homeostasis, all the way down, which is basically body balance, all the way down to the cellular level. The thing is, it remains dormant in your body unless it is fueled by these cannabinoids. Cannabinoids being either endocannabinoids, which your body makes itself, or phytocannabinoids, which come from the plant, like the cannabis plant. And they interact with these receptor sites that are all over your body. What they do, well, the basic mechanism, to keep it pretty simple, is that they assist in releasing these neurotransmitters that then communicate vital information to the cells, to the tissues, to the organs. And that's how all these other body systems are able to stay in balance and in homeostasis.
Well, what you're mentioning, what you're mentioning there is let me help break this down a little bit. It is, we have discovered, scientists, medicine, and research has discovered this cannabinoid system in the human body that is mostly located in the brain, spinal cord, and in your immune system. And these cannabinoids go through your body. Your body produces them. They're natural. They're called endocannabinoids. Your body has them in them right now. Whether you've ever smoked a joint or taken CBD oil ever in your life, these things are in your body, produced by your body. And they act as surveillance. They act as mediators. They act as signalers to let all these systems know that they're all in harmony, they're all working well together, and the scientific term for that is called homeostasis. Everything is cool, everything is happy, all the systems are running well. And if our body runs low on its own produced cannabinoids, we can supplement that. Just like if you're low on iron, you can supplement your body with iron. If you're low on vitamin C, you can supplement your vitamin C. If you're low on cannabinoids, you can use these phytocannabinoids to supplement and to bolster your existing system. Do I have that kind of right?
Well, you summarized that very well, Dr. Shoup.
Well, thank you.
And it's very common for us to be deficient in our endocannabinoid production. That does decrease as we age, and other lifestyle factors create a deficiency in our own production of endocannabinoids. We have a lot of toxins that we are exposed to on a daily basis. So most people have a very low production of their own personal endocannabinoids. But like you said, the good news is we have something now that not only mimics the action of the endocannabinoids in our own body, but it can actually increase the production of our own. And that's kind of a dual role that they play in keeping us healthy.
Well, that's interesting, because I'm sure many of my viewers are thinking about the fact that, well, they maybe take, the men maybe take testosterone supplements. The women may be on estrogen or bioidentical hormone therapy because their own systems don't give them enough. And as they age, those systems have broken down and not allowed their body to have enough. What you're saying is this cannabinoid system actually winds up doing the same thing over age. It deteriorates and depletes, and we wind up in a depleted state. So let's go forward then and talk about when you take CBD oil, what effect are you looking for on your health? What things will people see? What will they feel when they start taking CBD oil?
Well, one of the things I want to say in advance of anything that I'm about to say is that what I'm going to talk about are research-based benefits. I don't want to make any medical claims about a CBD oil specifically, because we can't do that. But what we do look at is all the literature and the research that's been done. And we can say that for pain, that is probably the number one reason people would take a CBD oil product. And when we talk about CBD oil, we are talking about a full spectrum CBD, more than just an isolated CBD component. So that's one thing that when you're dealing with pain or other symptoms, you want to make sure that the CBD oil is full spectrum. You have all the effects of the plant. But again, back to the question about the pain, that is probably the number one reason, and we're seeing amazing results with that, simply because what we mentioned before, the endocannabinoid receptors are, the CBD oil is reacting with those endocannabinoid receptors, and it helps release our own neurotransmitters that are responsible for pain reduction.
The other thing that you were going to talk about, and the other thing that we think about, it oftentimes is associated with pain, or particularly chronic pain. So if you are a chronic pain patient, and we know we have this opioid epidemic in the United States right now, how much can CBD oil help somebody that has a chronic pain issue but doesn't want to get involved with all the opioids that are in the marketplace?
Well, it can be a fantastic substitute for that. And that's what we're seeing. We know that, as you mentioned, that opioid crisis is out of control. And so I truly believe that as we learn more and as we experiment more with the CBD, I can see that this is going to have a huge impact on helping people reduce the use of those opioids and the over-the-counter NSAIDs and a lot of the different medications that people are taking right now.
Well, one of the other things that is going to be big, and I'm watching, make sure, because we have so much information to cover, but so little time. Anxiety and depression are also one of those things. Talk about that for a minute.
Those are, again, when we talk about anxiety, depression, mood disorders, social anxiety problems, sleep is another big one, and insomnia. These, again, have to do with the fact that you have endocannabinoid receptors primarily in the brain that help when the CBD oil is ingested. It helps to trigger the release of serotonin, which is our happy hormone that helps release endorphins, which is what gives us that runner's high, and other neurotransmitters that help with relaxation and stress reduction. So again, it is giving your body what it needs to release its own hormones and neurotransmitters to help calm you down. And I've had a lot of people take the CBD oil prior to going into a crowded room or speaking, and then many people can actually feel it work pretty immediately.
Now we've got about a minute left, and so I want to talk about dosage. there really isn't a lot of science. There's not a lot of empirical data to help people understand how much CBD oil do I take. How do you recommend, what do you advise people to do when they're starting to think about using CBD oil? How much do you take?
Well, again, that can be a very confusing aspect. It depends less on the milligram amounts in your CBD oil. It depends more on the bioavailability of the oil that you're using. So if you're using an oil that is, say, water soluble and it's very bioavailable, you don't have to take nearly as much. You can take a little bit less. But basically, the bottom line is, it is going to differ from one to the next. But I usually would start someone on maybe one dose a day, which would be, or half a serving in the morning, half a serving in the afternoon, which is about a half a milliliter morning and half a milliliter in the evening. And then monitor that over the course of several days to see if we need to titrate that up, titrate that down, because everybody responds so differently. You know, we're different on the inside as we are on the outside. So everybody has a different response to how their cannabinoid system, or how their body responds to the cannabinoids. So again, there's no one dose fits everybody. But knowing that it's very safe and a powerful natural treatment, it makes it easy to sort of experiment with that. The rule of thumb is to basically start low and go slow in going up. Many times you can actually go down with CBD oil. Sometimes less is better. So it sounds like I can't answer that question, but honestly, there really is no good answer for that because it depends so much on those other factors.
Well, Margie, I thank you very, very much for being with us. You've given us a wealth of information, and I know the folks that are watching the program will have much more information and much more ability to make these good, high-quality health decisions for themselves. Thank you very, very much for being here. I really appreciate it. And all of your contact information is going to be on the screen, so if anybody wants to contact Margie to have her help you, please do not hesitate to do so. So, until you and I have a chance to chat next time, I want you to be sure to brush and floss.